Followed by St. Albert.
Thank you, Mr. Speaker. I know the passion that we all share for our kids in care. They often come from backgrounds of tragedy or maltreatment. And that's why I hope the Minister of Human Services is taking a close look at the Child and Youth Advocate report that sheds some light on some troubling trends under this government. Over the past 5 years, the number of children under the age of 10 living at staffed facilities remains unchanged. These kids will face inherent barriers to their own development living at these facilities, so can the Minister tell us why we are not seeing these numbers go down across the province?
Hear, hear. Honourable Minister.
Mr. Speaker, I've not had the time personally to review the Child and Youth Advocate's report. I'd be glad to take that question under advisement. I do know that the overall number of children in care has decreased, and the Minister is working very hard on that, but I'm going to take that question under advisement.
Honourable Member.
I was referring to staffed facilities, Associate Minister, but considering that the Child and Youth Advocate makes it clear in the report that the government is contravening its own legislation for how our young children are being placed, can the Minister explain why the government is not acting in line with its own rules and regulations?
Hear, hear.
Honourable Minister.
Mr. Speaker, I'm aware that the member is asking about staff facilities. That's one component of care that we provide for children. As I said, I'd take these questions under advisement for the Minister of Human Services.
Honourable Member.
Very effective day at question period, Mr. Speaker. Given that youth are coming into care with heightened mental health challenges and are facing extensive wait times for mental health services due to extremely limited programming, what is this ministry going to do to make sure that our children who require this essential service receive the help and care that they so desperately require?
Hear, hear.
Honourable Minister.
Mr. Speaker, our government takes mental health and addiction services for children and youth very seriously. We have currently $9.2 million in grants to key government agencies and not-for-profit groups to support mental health, to provide additional support, in fact, following the floods in June. We work very closely with the Ministry of Human Services and Education to offer a large number of mental health programs, including enhanced 24-hour health care workers in emergency departments and mental health crisis intervention services for children and youth. Mr. Speaker, I could go on at the list of partners, multiple and very significant partners we have in this endeavour, and we'll be continuing to expand those efforts in the future.
Honourable Member for St. Albert, followed by Strathmore Brooks.